Mixing the alginate. Place the appropriate amount of water into the bowl. Shake the can of alginate to fluff the contents and carefully lift off the lid to prevent the particles from flying into the air. Sift the powder into the water, then using your spatula, mix with a stirring action to wet the powder until it has all been moistened. Firmly spread the alginate between the spatula and the side of the rubber bowl. The mixture should appear smooth and creamy. Loading the mandibular impression tray. Gather half of the alginate in the bowl onto the spatula and wipe the alginate into half of the tray from the lingual aspect. Press the material down to the base of the tray to help remove any air trapped in the material. Smooth the surface of the alginate by wiping a moistened finger along the surface. Place additional material over the occlusal surfaces of the mandibular teeth. Retract the patient's cheek with your index finger and turn the tray slightly sideways when placing it into the mouth. Center the tray over the teeth. The posterior border of the tray is pressed down first, followed by the anterior portion of the tray. Ask the patient to lift their tongue to the roof of the mouth and then relax. This will allow the alginate to form an impression of the lingual aspect of the alveolar process. Instruct the patient to breathe normally while the tray is in place. Observe the alginate around the tray to determine when the material has set. To remove the tray, place your fingers on top of the impression tray to protect the maxillary teeth from damage. Gently break the seal between the impression and the peripheral tissues by moving the inside of the patient's cheeks or lips with the finger. The handle of the tray is grasped with the thumb and index finger, and a firm lifting motion is used to break the seal. The tray and impression are snapped from the dentition. Evaluate the impression for accuracy. Rinse, disinfect, wrap in a slightly moistened towel, and place the impression in the appropriate precaution bag. Loading the maxillary impression tray. Load the maxillary tray in one large increment and use a wiping motion to fill the tray from the posterior end. Place the bulk of the material toward the anterior palatal area of the tray. This prevents the alginate from flowing beyond the tray and into the patient's throat during tray placement. Moisten your fingertip with water and smooth the surface of the alginate. Using your index finger, retract the patient's cheek and turn the tray slightly sideways to position the tray into the mouth. Center the tray over the patient's teeth. Seat the posterior border of the tray first to form a seal. Direct the anterior portion of the tray upward over the teeth. Gently lift the patient's lips out of the way as the tray is seated. Hold the tray firmly in place while the alginate sets. To avoid injury to the impression and the patient's teeth during removal, place a finger along the lateral borders of the tray to push down to break the palatal seal. A straight downward snapping motion is used to remove the tray from the teeth.